Well, it's my first time calling the Northern Health medical bus. Let's give this a try here. Hopefully I won't get a scam call or a call for Cody Robinson at the same time. I wonder if somebody in the building here knows him. I'm going to try and ask if I can be
Thank you for
waived
calling
of the
One
fee
Bus
because
Reservation. One of our agents
I
will be with you
expect further
shortly.
complications to get reimbursed or covered the cost of I think it might be $10 each way, and already stopped at Ministry who wants the lady at the hospital to help me because I mentioned her. But
Good morning, Northern Health Connections.
oh, hi, I'd like to book for Monday, the December 1st coming up.
Okay, what is your phone number?
It's a new number, so plus it's the first time I try you guys, so
So, so you're traveling for a medical appointment?
yes, and I'm not sure if they'll put me under or not for the procedure, but either way, it'd be easier than taking my vehicle.
Okay, so we need a letter sent in. Have we received that yet by email or fax to confirm your scheduled appointment?
Oh, I thought you guys had access to the system that could confirm that.
No, we provide a service for Northern Health. We don't have access to that kind of information. You actually, because it's confidential, you have to request them to send us that.
Okay, I don't see a fax number on the form here that I got with your schedule.
Oh, okay. I can give it to you if you have a pen.
Oh, yeah, because I don't have any way for me to. I only have a piece of paper, and I wrote the date on it when I got the letter in the mail. So yeah, okay. So I'll contact the social worker at the hospital and ask if they could fax it. But I've already asked many things related to getting compensation for expenses. I'm not sure if they'll do it in time. So, what's your number? Fax
I'll
number?
just explain. Yeah, I'll just say we're a medical transportation, right? Everybody needs to verify their appointments. So it's 250
Yeah.
564 7422.
Okay, so it's 564. Okay, and that's your fax, right?
Yep.
250-564-7422. Okay, so it has to be done before when for the Monday, the fax?
Sunday.
Oh,
You can
okay.
book on. You have up until Sunday to book on.
Okay, and then what, the driver kind of sees my name on the list?
Exactly, and your ticket will also be emailed to you.
Well, I don't have data on my phone, but I could take a picture of an email if I check my internet before that. I don't have internet at home. I'm very low income, and I'm wondering if I have to pay anything for this bus.
Well, yes, it's a reasonable, affordable transportation. So you're leaving from Prince Rupert and you're going to
Terrace and coming back the same day.
where?
At Terrace Hospital.
Okay,
Yeah.
so it's yeah, so it's $10 each way. So it's affordable transportation. There's a cost to it. It's just affordable.
It's $20. And I have to pay cash to the driver each time. Okay. Can I confirm?
We don't even we don't even have the option to pay cash. Everything has to be completed over the phone.
With you right now? Is that what you're
Not
saying?
right now, but after you verify your appointment, when you call us back to book, to complete the booking, you require some sort of a credit card, whether it be a prepaid, a Visa debit, or a credit card, Visa Mastercard.
After you
Require
guys
payment at time of booking.
after you guys have received the fax.
Correct.
Okay, now will you guys call me when you receive the fax?
So we are a call center. We cannot always guarantee that we'll have the moment to call you back. So it's always best to give us a call once you know it's been sent.
Man, I wish you'd hire a driver that can collect money that you can trust in that way. You're adding a lot of steps to me. I'm not, sometimes I
I know,
want.
sir. way, right? Like we're only given what we have to deal with, and these are the policies and procedures.
There are machines the driver could also carry, right, to avoid cash, but you guys don't work in that way either.
No, we don't have that. No, we don't have that option, and that's a Northern Health decision. Okay, so.
Okay, well, I'll make a note to let them know. I don't know. They're not very good at problem solving based on previous attempts. But anyways, okay, so it does take at least 2 phone calls, especially if it's the first time. But I mean, it's got to be 2 phone calls every time because you need the new proof of the appointments every time, right?
Well, or you could just take the step and make sure that's sent in before you call the first time.
Oh yeah, okay, yeah,
right?
yeah, because now I have an account, so, and you might even call back if you have time. If it's done in advance, you guys try to confirm things on the list in advance if you can, eh? Is it that you need more telephone operators? Because I am looking for part-time work, and I do have a phone.
We're located in Prince George, so you'd have to kind of live in this area.
There's no way to do.
Transit in that area might be looking for work.
What do you mean transit in Prince George?
No, in Prince Rupert, like in the Prince Rupert Terrace area, they might be looking for employers.
Yeah, I'm not sure what you're saying. I'm asking you if you guys don't have enough people for answering calls, and now but you are saying that you insist it is done at a call center. Even if we pass a criminal record check and things like that, you guys we can't do this job from home.
Oh, I'm sorry, sir. I'm confused on what you're questioning. I'm just doing my job, and these are the requirements. So it's not like you're the first person that calls in. It might seem like a lot of steps, but in order to use this service, you need to qualify for it. And in order to qualify for it, you need to have a scheduled appointment that's verified. Okay?
Yeah,
We've been cashless for 5 years. Like there's changes that
Ma'am,
happen to any
ma'am, can I
service, any company.
Yeah, so I'll just bring you back to what I meant because I think you might have misinterpreted. I am looking for work, and you had said that your callers don't always have time to call somebody back when the fax is received. That's why I said if you needed extra callers, and I could do it from home. That was my point. But otherwise, we're all done with knowing what to do for the drive in the bus on Monday. Except that I just wanted to confirm the times. I think it leaves at 8 from Prince Rupert.
Correct.
And then my
5 p.m. from Terrace.
Okay, and my procedure is at 12, so yeah, it should be ready. And it'll be wherever they drop me off at the hospital. It'll be the same pickup at 5 on the Monday. Okay, just in case you guys want to know, because that's more you than Northern Health maybe, is I ask at the hospital where you guys stop your bus, and it's the same place where the transit is, but it doesn't say this is Northern Health medical bus stop as well as the regular, BC Transit. So I had to find out myself, right? They don't really inform you of that. So maybe there is. I know.
Is there now, just a little bit further from the BC Transit stop. That sign is there now for the Northern Health. Okay.
Oh, it went there since yesterday. Okay, but it is the same stop where they just built a new shelter there. Okay.
Yes, it sure is.
Okay, I'll look for it. Okay, thank you very much.
Okay, sir.
Okay.
Thank you.
Thanks. Bye bye.
Have a great day.
You too. Bye bye. You know what? I'm not gonna hang up. I'm just gonna try to call Judy again to see if she'll fax this, and hopefully I'll get it. I'd like to take a shower, but I have to leave very soon. So many steps employed people get unemployed people to do. It's too bad. It's too bad they can't be consumer-centered or client-centered or patient-centered. It's too bad. This is a lot of extra work. So that's the way it's done, sir. You just have to be a good sheep and go through this fence. It goes this way, and then And then, they take all the meat and then the skin and all this stuff, right? Except for me, I could prove my appointment by showing my elastics after to the driver if he wanted. Okay, please answer. She might have answered email, but this is a new step that I didn't mention in the email yesterday. So it's one of the reasons I don't always want to bother with appointments.
Call has been forwarded to voicemail. The person you're trying to reach is not...
Oh, okay, call ended. All right, so it doesn't want the cell phone. I'll try the other phone number. The cell phone might have been hers, because if you called a work number, it's somebody else's name, and they supposedly have never succeeded in changing that as professionals. Right? If I was there, somebody would give me permission to know the password to access the voicemail to do the changes, I could do it. But really, it's about not making the efforts. And because you have to learn something new. Oh, something new! Hello?
Good morning. Is Martin available, please?
Speaking.
Good morning, Martin. My name is Ashley, and I'm a nurse with Northern Health.
Okay.
We received a voicemail from somebody wanting to connect in regards to some STI results. Was that you?
Yep.
Yeah, okay. So I just have to make sure I have the right Martin before I can share any information, okay?
Okay.
So Martin, is your last name? So it looks like you did some STI on demand testing, and I'm just gonna pop open those results. Do you feel comfortable getting them on the phone?
I'm the only one here, but also I would like them in written format for my records.
Okay, so that I might have to investigate, because usually this comes up on Health Gateway. So, do you have access to Health Gateway?
I don't know if it's the same as Healthy Life, but Healthy Life, you don't see HIV and the other one.
Okay, so what might have to happen is, do you have a family doctor?
No, of course not.
No? Okay. I might have to look into that for you, because I have never released STI results before. So I would have to look into that.
Okay, you can still give it to me right now, but
I
then
can
I'd
do
still
so.
like to have a record.
Yeah, for sure. So I have a negative result for chlamydia and gonorrhea. It's negative.
Mm-hmm.
Okay, just give me 2 seconds. We're loading the other ones. All right, and then, it looks like we did 2 swabs for chlamydia and gonorrhea. Let me pop open that one. The other swab, which looks like was a rectal swab, is negative for chlamydia and gonorrhea.
Okay.
And then the HIV results, they are non-reactive, so they're negative.
Okay.
What is this one? That just says test information. What does that mean?
It would be syphilis, the last one.
Yep, syphilis is non-reactive. It is negative. So everything's negative.
Okay, so just to let you know, I did the extra swabs because it didn't come with instructions. It came with a code as if everybody has a phone with data. So that's kind of a flaw that made it. Plus, they don't give you a little piece of paper with instructions. So I had to kind of just be sure I got it right by just kind of not having to go another time, because it was the second time. The first time they kind of lost my results, HIV.
Oh my gosh, how convenient. Okay,
so I would, so you have my address, right? I would like somebody to just mail them to me. Nobody else opens my mail, so.
Okay, so there is a process that I'm sure Northern Health has for release of information. So I'm going to have to look up that process. I'm not sure what it is.
If you're making a recording, I am giving you permission to mail it to me. Okay, so use that recording as the permissions, because, asking people that are poor, that don't have printers or fax or scanners, it's just a lot of extra things to do to kind of get the paperwork, when you guys can just use these recordings. You verified me, you can just do that. My address.
Okay. I'm going going to see what our policy is for release of information. You might have to request it yourself. I don't quite know, but I'm going to see what I can find out for you, and I'll give you a call, okay? How's that sound?
Yes, but aside from that, is this flaw in the system has to be corrected because you accumulate so much expenses and back and forth and chores during the day to compensate for how complicated it is. Like, I think BC knows, just like a lot of provinces, how many people don't have general practitioners, and yet there's very little adaptation to to help somebody like me that is the main manager for my medical care, right? And that I'm always finding the biggest obstacles to my medical care are paid medical staff. So
Okay.
yeah, so it'd be nice if you guys kind of figured out that maybe it should be included in Healthy Life, or it should be that whoever's office I called now just contact somebody. And like there's a lot of things that are okay to send by email. There are ways also you can put a code, right? You inform somebody in one email, there's the code, and this is how you open a PDF, right? You guys can look into this, but it's not really my job to kind of teach you how to give me less steps to jump through if you're
Yeah.
patient-centered, right?
Absolutely. Just because I am bound by Northern Health policy and confidentiality pieces, that's why I just want to look into the process for you because, like I said, I've never released the STR results via, given a hard copy. So that's why I want to look into it just to make sure I follow my...
I travel a lot, and it's important to have records in hard copy. And by the way, I do give you permission to act as a culture repairer and find ways to resolve this when you look into it.
Excellent. All right. I'll see what I can find out for you, and I'll give you a call back, okay?
Thanks for calling.
Okay. No worry, Martin.
Okay. Bye-bye. Man, I was running out of data. I had to move things really quickly. What was I doing now? Oh yeah, I was calling again. Where's the card? Oh man, I really want to go take a shower. They call on their time, not always my time. But anyways, I have to have realistic expectations. Not sure if I was receiving a call or I accidentally pressed something here.
Tracy Downey, the Aboriginal Liaison Worker of the Prince Rupert Regional Hospital.
That's the old person
I'm sorry,
I used to
I'm
work
not able
there.
to take your call. I will get back to you as soon as possible. Thank you.
Record your message at the tone. When you are finished, hang up or press pound for more options.
Okay, hi Judy. I just called the Northern Health medical bus for the first time, and they tell me that somebody needs to fax information that I don't have. So can you please fax to them at 250-564-7422, and it's a confirmation of my appointment in Terrace at noon. I do not know if you email me back from yesterday because I do not have internet at home or on my phone, and I do not check it every day. So please call me back if you can, just to confirm things so I know to call the Northern Health bus back and then do the payment.